Inner Light Show. It's time to stop just surviving, and it's time to begin to thrive. It's time to live happier and healthier. Turn stress into strength. Noted author Debbie Mandel will show you how to move beyond personal doubts and fears and into positive perception to turn on your inner light. Here's your host, Debbie Mandel.
Greetings, everyone, and welcome to my show. Our guest expert, Stuart Fleischman, MD, visits cancer centers around the country for the American College of Surgeons Commission on Cancer Accreditation, where more than 70% of patients are treated nationally, has developed a supportive care program in oncology at Long Island Jewish Medical Center, where he chaired the Bioethics Committee, and he is the author of Learn to Live Through Cancer. This is a great read for treatment and for prevention. It's so comprehensive. It's everything you wanted to ask about cancer, but maybe were afraid to. Welcome, Stuart.
I thank you for having me.
Now, what is the first thing one should do when diagnosed with cancer?
Take a deep breath. That's important because when any of us hear that we have cancer, it seems like it's an emergency. And for a small number of people it is. If you can't breathe, if you are not urinating or don't have bowel movements for days at a time, if there's a change in your ability to understand your surroundings and be coherent, if you've had a bleeding problem that's serious, those are emergencies. But those are the minority of people. And most people can go around collecting information and opinions and developing a really smart treatment plan. So for most people, the first thing to do is take a deep breath.
How does one get rid of the mindset? I mean, it's not as bad as it used to be. I have the big C. I'm going to die now. And now my mortality looms over my head.
Well, everybody thinks that. Many people don't have the courage to say it, but most people, or I think virtually everybody, worries that they're going to die, to be dependent upon a healthcare system that none of us really trust these days anymore, will be in pain, will be disabled in some way. That's what we're all thinking. So instead of trying not to think it, just people need to be remember, and their family members need to remember, that this is part of the process and just go with it.
Well, now that you bring that up, what shouldn't we say to cancer patients, and what should we say?
Well, most people, especially those in the middle and after treatment, really don't like to hear, "You look great." That sounds like a really good compliment, but most people don't feel great. So that's one of the other things. I think the other thing that people don't like to hear is, "You'll be fine." Well, none of us know that, and it's kind of empty reassurance.
So if I want to make a cancer patient feel good or show my empathy, what should I be saying as opposed to "you'll be fine," which sounds like phony cheerleading?
Well, in our usual social conversations, "Hi, how are you?" Many people say, "Well, I have cancer. How could I be?" So, "Hi, how are things going? How are things today? How are you feeling?" is a really big difference. Those are good openers.
Mm-hmm. And if you're a friend to a cancer patient and you notice them feeling weak or tired, can you say to them, "Is there something I can do for you?" Or does that sound too open-ended and vague?
Absolutely. This looks like a bad day. Is there anything I can do to help? Is great.
Mm-hmm. So what if I take a cancer patient out to lunch, a friend? Do I talk about the disease, or is that a time for this person to feel human and normal and we're just having lunch?
Well, it could be either or both, but many people during chemotherapy, most of the time, and radiation part of the time, are extremely sensitive to smells. So think about going to a place where the food isn't too odoriferous, and then speak for a few minutes about the cancer. Say, "Tell me, let's speak a few minutes about the cancer and then talk about something else." Is that okay?
Oh, I like that. That's like when you go out on your first date and you want to get the first kiss over with. So you don't have to be nervous, so then you could talk. So yeah, that's very good strategy. Now, the role of exercise is becoming very important, I think, for breast cancer or colon cancer, post-treatment to prevent reoccurrence. Yet most doctors don't really talk about exercise with their patients. What are your thoughts?
Well, that's true. It's been better proven in both breast cancer and colon cancer survivors. But the idea of having a program to follow while you go through your treatment, that includes activity. Most people hate the word exercise, so we call it activity. Good rest and sleep and really sound nutrition, those together can really make a difference.
Now, this is a show on stress management, and I've read studies either way that, stress can hamper treatment or it can even trigger cancer. What are your feelings on both? I know that's a very loaded question.
It's a loaded question. The best done studies show that stress does not affect survivorship, and stress does not affect if you're going to get a recurrence, or doesn't stop treatment directly. What it will do is to affect it indirectly. So if you're told you need to walk 4 blocks a day and eat 1,800 calories or 2,800 calories and get some sleep, and you don't, you're going to wind up in the hospital, probably with a big infection, or maybe a bleeding problem, or any host of things that can happen. So there's an indirect effect on all of the outcomes. If stress is preventing you from following the really sound activities and things that you need to do during your treatment, but directly no. And there's a pressure out there that people, many times family members, feel that the individual with cancer has to be happy, and they need to twist themselves in knots to be happy so the treatment will work, and that's just not true.
And I have read some studies where stress can impede the absorption of chemo for the first 48 hours, that they want you not to be stressed. Does that have any validity, or is that a rogue study?
I don't know about studies like that. It seems, from my experience, somewhat impossible, because if stress alone could do that, then we could help people stress out better so that they could absorb more of their chemo, or they could will their cancer away, but that doesn't happen.
Yeah, and we make people feel guilty. Well, we go to commercial break, and we will return with Dr. Stuart Fleischman, author of Learn to Live Through Cancer.
You can take Debbie Mandel home with you. Her book, Turn On Your Inner Light, Fitness for Body, Mind, and Soul, will help you decompress with healthy, positive, concrete solutions. Common life challenges are presented so that you can quickly find the help you need. Emotional tips, original meditations, and a fun and easy-to-follow fitness workout for each mindset. This revolutionary new method will help you rewire mind and body to take back your power. Get it on Amazon.
Are you overwhelmed with the burden of taking care of children, parents, or both? Are you taking care of everyone else except yourself? It's time to change your habits and re-energize. Debbie Mandel gives you an innovative and easy-to-follow program for good health and happiness. In her magical new book, Changing Habits, The Caregiver's Total Workout, Debbie Mandel shows you step-by-step how to find the optimal balance between giving and receiving, and guides you to exercise and eat right to take care of yourself. What are you waiting for? Read Changing Habits and start training for your life. Life does not need to be a burden. Get Changing Habits, The Caregiver's Total Workout on Amazon.
You're listening to the Turn On Your Inner Light show. I'm your host, Debbie Mandel, and I'm speaking with Dr. Stuart Fleischman, author of Learn to Live Through Cancer. I'm intrigued by the title. How come you didn't write, like, Learn to Live with Cancer, but Through Cancer?
Well, for most people, having cancer is a month-long process. And sometimes people are devastated at first, and they go through the motions and all the things that they need to do during treatment. And then afterwards, they think, how do I get my life back? And the best way to do that is to reclaim your life on day number 1, and that's the concept of living through, because there are many things that people can do all the way through treatment to make the recovery easier and to make their life better, as bad as it is during treatment.
So that you don't postpone and you go with it, you understand it, and I guess you can deal with the intensity. Now, how does one fight cancer? Are you a pacifist, or are you one of those who kind of insist we do battle, or is that up to the person?
Well, probably, ideally, it's a little bit of both, but somebody is the same person during the midst of their treatment and afterwards than they were before. So the best thing to do is to approach things with the same intensity and manner that you approached other crises in your life where they worked out well. Mm-hmm. So use what you do best. Some people go along with the flow. Some people need every piece of information and want to drive as much as they can. And if that's what they do, there's room for everybody.
That's an interesting point, because patients tend to get objectified sometimes during procedures or testing or treatment, even by technicians. They forget the patient's in the room and talk about the patient, and the patient says, who, me? Is that happening to me? Now, how do I really know I'm getting the right treatment? For instance, with prostate cancer, there are so many opinions. There's surgery, there's the radiation, there are the seeds. How does the patient make sense of it all?
Well, in general, prostate cancer is not an emergency unless it's obstructing urination. So there is time to learn. On the internet, there are some very good sources. Standardized treatment guidelines for prostate cancer are available to the public through the National Comprehensive Cancer Network, nccn.org. They're in English, real English, that most people can understand. And probably the best thing to do is to seek treatment at a center that's accredited. I'm very biased about this, accredited by the American College of Surgeons, Commission on Cancer. There are 1,500 centers across the country that are accredited. That covers over 70% of the people who are diagnosed. And that tells you that somebody's coming in, snooping around, asking good questions, looking at records, looking at their procedures, and making sure that about 75% of the cases that the patients that come in, each case is looked at prospectively, before the fact, by the core disciplines, medical oncology, radiation oncology, and surgical oncology, so they can decide what's best for you and which part of the guidelines are best for you to follow. Getting a second opinion in one of these places can also help if your insurance has an exclusive contract with a center that isn't accredited, but you can make sure that what they're going to be doing, which is usually the same thing that the accredited centers will be doing anyway if it's a good place, that they'll follow the guidelines that are appropriate for you.
So you recommend a team approach. Who would be the gatekeeper?
Well, in prostate cancer and breast cancer, the gatekeeper can be any of the specialists. It could be, in prostate cancer, your general urologist, or it may be a surgical oncologist, a surgical urologist. It could be a radiation oncologist or a medical oncologist. And in fact, for many patients, the gatekeeper tends to change as you go through the different modalities of treatment, as long as they communicate with each other, they speak with each other, and their care is coordinated with each other.
So, and also, it might be your own temperament involved, too. For instance, some people, I think, with prostate cancer cannot bear to think, oh, I'm going to live with this cancer and we'll keep checking on it. It's slow growing. Get it out of my body. Some other people might not be able to live with the byproduct of getting it out of your body with removal because of the incontinence factor, which can happen. Also, there seems to be so much dissension about the PSA. Should people take a PSA or not? Do you think there's over-testing in general?
Well, the testing, we really, although we have uniform guidelines for testing, many of those tests need to be the result of a discussion between you and your primary care provider. Because depending upon what other illnesses you have, what else is going on in your life, less testing may be best for you. On the other hand, some people really do need to have tests, and if you're the one who something is found that can save your life, that test is very meaningful to you, but maybe not for all of society. Mm-hmm. So although there are guidelines, the individual testing regimen needs to be a byproduct of a good discussion with a doctor who knows you.
Now, there's the rub, Stuart. A doctor who knows you in a good discussion. And there are so few doctors with these discussions. I think that before our interview, we were speaking about how patients get educated by reading garbage on the Internet.
Well, that's true, and that's what many people do instead of really accessing good information. But in an accredited center, it's not a dyad of a patient and a doctor. There are a number of other people who are empowered to have these discussions. There's a good oncology nurse. There's an advanced practice nurse. There's an oncology social worker. There's a nutritionist. There's a physical therapist. There's a chaplain. The idea is that you get different pieces of information from other members of the interdisciplinary team, or in fact, they have the time to provide the information where the doctor is on a 7-minute visit. So having a team approach really makes sense to get the right information.
So that's our mantra, the team approach. Well, we go to commercial break, and we will return with Dr. Stuart Fleischman, author of Learn to Live Through Cancer. Dear listeners, I'm excited to tell you about my new book, Addicted to Stress. This is a message you need to hear. Are you addicted to stress? Do you do it all while everyone depends on you? Where's all this pressure coming from? It is coming from inside you. This is why my publisher, John Wiley, asked me to write Addicted to Stress, a woman's 7-step program to reclaim joy and spontaneity in life. This fun-to-read book teaches proven strategies to reclaim your life, silence your inner critic, build a healthy body, and reframe your thoughts to change your life for the better. Dare to be happy without the guilt. Addicted to Stress is easy to get. It's available at Barnes & Noble and other fine bookstores everywhere. You can also buy it at Amazon and other online retailers. Back with Dr. Stuart Fleischman, author of Learn to Live Through Cancer. It's always easier to prevent than to treat. Are there things we can do to arm ourselves in the war?
Well, that's a harder question because we'd like to believe that there are things we could do in clean air we can breathe, but it seems that it's a lot more complicated than that, and the genetic component may be a lot more influential than any of us would like to think. Probably the best thing to do is to be generally healthy and to get the proper screening tests when, after that discussion we just spoke about, so that if something is growing, it's found small and it can be cured.
Okay, so basically you're not going to tell me superfoods and exercise that or even our mindset. Some people claim that there is that emotional, spiritual component that we kind of bring it on ourselves, and then the patient feels guilty.
Well, you bring up an interesting point. That mindset theory is really not scientific, but the other things that you mentioned are really important. The superfoods that are recommended in the anti-cancer diets are the same superfoods that are recommended for healthy Americans, and they're the same superfoods that are recommended by the American Heart Association to minimize cardiac risk. So the guidelines are the same all over. It's not what we're eating, especially in restaurants and fast food chains, but those guidelines are the same for everybody. And that, as we discussed before, the movement or exercise is becoming more and more of a known factor to help keep us healthy, both for cancer as well as heart disease.
Okay, so in other words, we want to follow a Mediterranean diet, basically, is what you're saying, and eat variety. Maybe purify our water as best as we can and eat more naturally, fewer chemicals, and get up and move. Sitting has been the bane of our society, perhaps.
Yep.
And the rest is just live your life and the quality of life. Now, I really think your book is so comprehensive and so clear, and it's nice to have everything laid out for you in black and white as a patient, because, you know, we all get flustered and don't remember things, and this way it's in the book and you can refer to it. It's really everything you wanted to know. Where can we learn more about your work?
Well, the book is one place. There's a companion book for providers that has all the evidence basis for the ideas in the book, and the idea about using exercise and diet and having a purpose in life and good rest and sleep, the Manual of Cancer Treatment Recovery, what the practitioner needs to know and do, and it mirrors the Learn to Live Through Cancer book. I think the best thing to do is to collect information at your cancer center and read the book.
And to maybe join a support group. What is your thoughts on that, to learn the experiences, the direct experiences of the patients themselves?
Well, support groups are wonderful, but over the last 10 years or so, especially as the Internet flourished, people are getting information, obviously, from the radio and from the Internet and many, many other ways, and they're able to communicate with each other electronically. So the idea of a support group has really translated into our new electronic media, and that process can happen in different ways, in chat rooms, on Skype, in a variety of different ways. The other thing about support groups is that when we did a survey a number of years ago and asked how important support groups are, and everybody says, oh, they're really important, but not for me, for someone else. I have support. So I think there's still a stigma that people feel weak about support groups when it's the most empowering part of the cancer treatment experience that's been known so far, but the stigma still remains.
That's a very interesting point, because I think some people don't want to hear it, and they process alone. Like when you are diseased, you feel alienated from humanity, and you continue that mindset. This has been a wonderful and informative. Thank you for making everything so clear and down to earth.
Oh, you're welcome.
And now we go to Affirmation of the Week. Be smart enough to know what you don't know. And for the latest medical trends. A new study by researchers at NYU School of Medicine reveals for the first time that metabolic syndrome is associated with cognitive and brain impairments in adolescence, and calls for pediatricians to take this into account when considering the early treatment of childhood obesity. While I'm on the subject of obesity, people whose blood sugar is on the high end of the normal range may be at a greater risk of brain shrinking that occurs with aging and diseases such as dementia, according to new research published in Neurology. For patients who have gone through breast or colon cancer treatment, regular exercise has been found to reduce recurrence of the disease by up to 50%. From Cornell University, your mood for food can be changed by a restaurant's choice of music and lighting, leading to increased satisfaction and reduced caloric intake, according to a new study. I think restaurants want to maximize you spending and buying as much food as you can, so, I mean, it would be surprising to see them encouraging you to eat less. A study from NYU suggests that early exposure to antibiotics can predispose the child to obesity. Very interesting. Another reason why we shouldn't over-medicate our children, especially perhaps for an ear infection. If you've recently hurt your back on the job, getting an MRI scan won't increase your chances of a good recovery, suggests a new study in the August issue of Spine magazine. And this, I found this very interesting. Another study finds allergy sufferers who rent rather than own their home are significantly less likely to make necessary environmental changes to improve allergy symptoms, suffering and overall quality of life. And that makes sense because you think it's not permanent, but it might be worth your while to do something positive, even if you're renting and it's expensive, to clear the air so you suffer less and feel better. Well, we come to the close of another show. I have an educational website on stress management, health, and wellness, totally free. TurnOnYourInnerLight.com. All the radio shows with the guest experts are archived for your listening pleasure. Just click and you will be taken into YouTube to hear the expert of the week or of your choice. Subscribe to my free newsletter from TurnOnYourInnerLight.com to get the latest link emailed to you from the radio expert of the week, a free new stress management article, and all the health tips I didn't get to say on radio will be there for you. Have a wonderful